Mhm.
Hello, everyone. We will get started in just a minute. All right, why don't we get started? Good to see everyone. I'm Jillian Gilchrist, Chair of the Endometriosis Working Group. So good to see you. Um, Thank you, Marge, for letting us know. So what we'll do is we're gonna start by going around the room and doing introductions. Do want to let folks know we are on CTN today. And so I will start with the boxes I see. So Jennifer, go right ahead.
Good afternoon, everyone. Jennifer Lombardi. I'm a program manager with Women's Services at the Department of Mental Health and Addiction Services, covering for Bridget Aliaga today. Nice to see you.
Thanks for joining us. Marge, can you unmute?
Yes. Hi. I'm Marge Frith. I'm on Cape Cod. I'm here. I haven't been here for a while, but I'm here today. And I just don't know where my picture is. My camera's on. I just can't figure it out. Me and the modern technology don't always jibe.
Well, we're glad you're here. Uh,
Glad to be here.
Right. Katie.
Hi, everyone. My name is Casey. I'm a clinical research assistant at Yukon Health and the clinical research coordinator for Endorise.
Arlie.
Hey everyone, I'm Arlie. I am a patient advocate and I am happy to be here as always.
Great. Representative Berger Javallo.
My space bar didn't work to unmute. It's like it's my first day on Zoom here. Apologies. Thanks for the intro. Yep, State Rep Amy Berger Javallo, member of the working group, and looking forward to learning as always.
Wonderful. Thanks for being here. Kara.
Hi, Cara Andrioli, registered dietitian in Glastonbury, Connecticut, and a member of the Academy of Nutrition and Dietetics here in Connecticut.
Wonderful. Thank you. Jasmina.
Hi, everyone. I'm Yasmina Kulancic. I'm the program manager for Endorise over at the Jackson Lab in Farmington, right on the UConn campus.
Great. Dr. Luciano. Oh.
Not working today. There we go. Sorry about that. Hi, I'm Danielle Luciano. I'm sorry I don't have my camera on. I'm in clinic today covering clinics, so patients and people in the background. But I am the co-director of CT Endorise. I'm a MIGS or minimally invasive GYN surgeon, endometriosis specialist at UConn Health.
Wonderful. Thank you. Carol.
Hi, everybody. Carol Johnson, CEO of Uterine Kind.
Great. Holly.
Hi, I'm Holly Dandurand. I'm with Extra Pelvic Not Rare from California. I'm not sure if Wendy will be able to join us today, but I'm here to represent.
Wonderful. Thank you. Lisa.
Hi, everybody. I'm Lisa Roy. I'm Director of Government and Community Relations for the Jackson Laboratory, and I help support the EndoRise program.
Wonderful. Sam.
Hi everyone, I'm Sam Maltz. I am a nurse and nurse educator, as well as an endo patient with both pelvic and thoracic.
Great. Georgie.
Hi, I'm Georgie Kovacs. I'm founder of FemPower Health, and I'm also working on a global endometriosis working group, obviously named to be redone, but great to be here.
Wonderful. Brianne.
Hi, everyone. I'm the clerk to the Human Services Committee and the aide to Representative Gilchrist.
Thank you. Brian.
Good afternoon. I'm Brian Knoyer, Director of Government Relations at the Connecticut Hospital Association, and apologize for being off camera, but I'm in transit at the moment.
Thanks for being here. Jessie.
Hey everyone, I'm Jessie Loesch. I'm the Director of Government Affairs at the American Society for Reproductive Medicine. Also, apologies for being off camera. I have a 4-month-old who is just on her own schedule and timeline, so sparing you all from the chaos over here.
Understood. Thanks for being here. Lauren.
Good afternoon, everyone. I am Lauren Cornegay, the founder and executive director of Endo Black Incorporated, also a Emory University MPH candidate. Thank you.
Awesome. And Daisy. If you're talking, you're on mute.
Daisy is, I'll go ahead and introduce her. She may be in the lab. So she's our new research assistant for the Endorise program. So she helps in the lab with processing the specimens.
Wonderful. Okay, great. Thank you. All right. Well, we're going to start as we always do. I'm going to give some space if anyone is interested in sharing their experience with endometriosis. All right, then we are going to move onto the agenda. But actually, before we get to the first piece, I just wanted to let folks know that I got a call from a state rep out of Texas, and I'll be having a meeting with them later in the week because they are interested in doing some legislation on endometriosis. So yay. So that's exciting. All right, so today the conversation we wanted to have is about the various education programs that are available. So oftentimes, which makes sense in this group, we have a conversation about getting more information into people's hands, right? That there's so many different, students, parents, educators, nurses. And so how do we get that information shared? And so wanted to kind of set the playing, put us all on the same level of understanding of what already exists. And so this isn't meant to be exhaustive. If we miss something, please feel free to share, but did reach out ahead of this meeting to see if folks could share what resources they've used, know about, so that we can just kind of walk through what already exists that people would be able to either use in their local communities, or maybe we as a working group could discuss, do we want to do anything to elevate them at the state level? So it doesn't appear she could be with us right now, but I want to thank my intern Jolie, who is getting her MSW at Master's in Social Work at UConn. She put together a PowerPoint for us, so I do not want to take credit for her work, but I'm going to pull up this PowerPoint so that we can just walk through. And as we're going, if you have used these programs and want to speak to them, please, go ahead and let the group know that. Again, this is just meant to guide our conversation because oftentimes it feels like it gets brought up and I don't want to recreate the wheel. I just want us to know what's out there. So can everybody see this? Can you give me a thumbs up? Okay. Okay. That's shaking. So let me see if I can make this bigger. Yes. So some of the ones that exist, let me move this box up, is the Endo What toolkit, which comes out of the Endo What organization. And the population is the general public and educators, and it's an online course and a video. Actually, so this is the chart. You can see all of these, and then I think she breaks it out into each one. Then there's Empower, which comes out of the Endometriosis Foundation of America. Think Endo, which comes from Project Endo and the Mayo Clinic. Inspired Inside, which comes from Uterine Kind. Planned Parenthood has health programs. And then Endo Rise right here in Connecticut, part of their work is raising awareness and training medical providers. Well, let me go to the next. So the Endo What toolkit, it includes a special edition film from the film Endo What, educational booklets, posters, a discussion guide, and some sample lesson plans. It focuses on real stories and medically accurate information, and it includes the film on endometriosis that sparked a movement. It's excellent for use in schools and community groups. What isn't included in here is Endo What also has the school nurse training, which I believe school nurses can get a CEU for completing from, I don't know what school, but someone correct me if I'm wrong, but I also believe Endo What does offer that for school nurses, because we've discussed in this group requiring that in the past. Think Endo, this is for primary care providers, pediatricians, nurse practitioners, and school nurses. It emphasizes early recognition and appropriate referral. It's backed by the Mayo Clinic. And the toolkit includes access to the PBS documentary Below the Belt, fact sheets, educational videos, academic resources, and CME credits in collaboration with the Mayo Clinic. So again, important that those CME credits are included. Then there's Empower by EFA. This gives a strong visual explanation of endometriosis. It's youth-centered, delivering endometriosis education and menstrual health resources towards school-aged audiences. And it includes curriculum for teachers, training for health professionals, and student-friendly educational videos. Then we've got Uterine Kind Inspired Inside program. This is school-based and research-informed. Its focus on conditions dismissed as bad periods, so abnormal uterine bleeding, premenstrual dysphoric disorder. It's designed for grade 6+, parents and school staff. So by saying launching, and folks are on from there, so maybe you can speak to it more. It's launching in California and Pennsylvania. The 2025 theme is She is Art and Science, and potential for Connecticut implementation. So let me finish the PowerPoint and then let's dive deeper, please. Planned Parenthood, who is a strategic partner with us, they offer broad reproductive health education. It's limited content on endometriosis, but there are opportunities to partner to develop endo-focused materials, and they provide tools to educators through their platforms. And then EndoRise, which their website includes materials for parents, researchers, and providers. They have brochures and pamphlets in development for public distribution. And then their upcoming events are the EndoRise Fall Forum, where there will be a public education event with CME credits available for providers. And there is a dedicated nurse practitioner event where the attendees can earn the CNE credit. They offer summer research program in collaboration with UConn Health for students interested in the endometriosis lab research. So I will stop there. If it's helpful to keep maybe that original chart up, or we can just go back to the full group. But for those of you who have either used these programs or have deeper knowledge, please raise your hand and please feel free to share with the group. Arlie, go right ahead. Oh, I'm sorry. Yeah, Arlie first, and then I'm sorry, Georgie. I didn't see the yellow. It got blended in.
No worries. I have experience with both the Below the Belt Endo Toolkit and Empower. And then one thing that wasn't on the list and was the Society for Women's Health Research. They actually have a really, I actually have a copy of it here because I printed the stuff out from their website. But they have like a little package of information that's pretty legit, very, very accurate. They have a toolkit that's like a patient empowerment guide, and then they have a specific one for teens as well that's very thorough. So I took both of the courses for Empower and the toolkit, and I think the one difference with after meeting with some of the school nurses in my town was that they did really like the visual, because that really grasps kids' attention, is having that visual. But I have to say, I feel that the Society for Women's Health Research, at least I like their packet of information the best, because in the back it just gives information that they can use to take with them to providers, like specific questions to ask providers, which I find is like really important. And then they have resources that also in the back, Endo Black, you're in there, EFA is in there, and the Below the Belt and the Endometriosis Coalition. But I really like that they provided like a health visit worksheet for teens. It just seemed a little bit more in depth in terms of providing them questions to ask providers, which I think is a big struggle for teens to verbalize sometimes what they're going through specifically, and then knowing what questions to ask providers is super important as well. So I'm a proponent for all of those, and I'm sure there's other great ones in there as well. But I would just say that we should definitely include the Society for Women's Health Research, their toolkits as well, as something to look at.
Wonderful. And what we'll do is, based on this conversation, I'll have Jolie add to this just so we can keep a running list, which will be awesome. So thank you.
Yep.
Georgie, followed by Lauren.
Thank you. Arlie, I'm glad you went first. So one of the questions that I had just looking at this list, and I'm only asking because I know my understanding is Endo what charges, because they're a for-profit. And my understanding is Endometriosis Foundation of America does not charge. And I haven't done a research assessment on what gets charged, what doesn't, like maybe education is free, the movie's not. So I would assume we need to probably add like a cost dynamic to this based on the goal that is to be achieved. But Arlie, it sounds like you've taken these.
There's no cost to Endo what But yes, in order to stream the movie, because they have certain licensing, you know, they don't just give that out to anybody. Um, so but in terms of like the other information, like going on and looking at their toolkit and stuff, that is those resources are free.
Okay. Okay. And by the way, thanks, Wendy, for clarifying. I thought I spoke with EndoWet and they told me they're for profit, so I may have misunderstood and misquoted. So I appreciate you correcting. Thank you. I know I don't want to misspeak, so I might have just
Sorry.
misremembered.
Maybe Shannon has changed it to for profit. I don't believe so. I know that so they've kind of spun out and done Project Endo. So I'm not sure. That could be something very recently changed, but to all my knowledge, it's still an NPO. But I don't know if they charge a fee that generates to kind of help continue investing into the nonprofit to keep growing. So yeah, we could probably double check that, Georgie, to make sure.
I'm so sorry because I'm sharing my microphone was in a weird place. But yes, I love we'll add a column too, because it would be important for folks to know if these things cost money. Lauren, go right ahead.
Yes, good afternoon again, everyone. I did drop the link for the Society for Women's Health Research toolkits, but I also wanted to share that myself, George Mason University, and Inova are working on a video game. Actually, the video game is out. It is a big video game specific to 13 to 25-year-olds where they can download it on their Android or their iPhone and play the game. It discusses period pain and endometriosis, and I can drop that information. And then I also wanted to share there is a campaign called Endo Voice where individuals can learn more about endometriosis, but also that people can get their CME certification. So I wanted to make sure I shared that. And then lastly, EndoBlack has toolkits on their website as well, which are really focused on patient navigating, whether it's understanding the Endometriosis Care Act. What do you do when you're going to the doctor's office? How do you really check off your symptoms, a symptom tracker, a question list? We also have patient navigating toolkits, so I'm going to drop that as well. And I apologize, I did not see the previous email.
This microphone will be the death of me. Sorry. No worries at all. And the point of this conversation is to really draw up this information too. So thank you very much. And we will get that down. Wendy, go right ahead.
Thank you. I'm having a disabled morning. Okay, so I know Arlie mentioned the Society of Women's Health Reproductive Health Program, and I have used some of that information before we created our nonprofit, created our own information for the community resources as well as for our younger individuals at our community events. My concern with their information, they have a great toolkit, is some of the information again is misinformation. So it's my concern is maybe they need to update it, and also they there's a little bias towards again the retrograde menstruation and not really looking at the bigger picture of the disease. So it doesn't really highlight disease beyond the pelvis, beyond reproductive organs. So that's a concern. And so the EndoWet program, the below the belt, I think EndoWet, the original school program, is actually very, very good because it hits a lot on the science-based part, as well as it brings in the teenagers and having to first deal with going through menarche. So I do really like that program. Again, my only thing there would be is it still limited in scope to more of the reproductive aspects, but when you're catering to a limited amount of time, I think it's very effective. Just a side plug, one of those things that we're looking at, the training and education programs, the big hole right now is in the pre-professional or the residents getting ready to graduate to become licensed. I'm actually going to be working with one of the endometriosis surgeons out of California who wants to help me create a continuing ed program, not a continuing ed program, but more of a residency program that would be geared towards the second of the 3 years, towards them preparing for being gynecologists per se, and making sure that we're including disease beyond just the reproductive areas, so that we're starting to pull in consultations with gastroenterologists, pulmonologists, urologists. So that's just a plug. So thank you.
That's fantastic. Thank you. Anyone else? Other programs we're missing? Feedback on programs you've used? Yes, Carol, go right ahead.
I could just give a little bit of insight to Uterine Kind's program. Do you want me to do that now or do you want me to wait?
That'd be great if you could do it, please. Yeah.
Okay, so just 15 seconds of background. For about 12, 13 years, I've built awareness and education programs with my team as part of the Advocates Agency and a female health awareness and education agency. We worked for all the big guys, Boston Scientific, Medtronic, Hologic, Acessa, Minerva. And the thing that we identified in that work was that those companies were educating at the point where the person has heard the word endometriosis, fibroids, PCOS, whatever it might be. And oftentimes it's a crisis point. And so it's very hard to educate in that environment. It's very expensive and it often doesn't stick. So we decided to pause our agency work, and that's when we launched Uterine Kind, which is an app that we are committed to keeping free for everyone to use, and we don't share, manipulate, or interact with data at all. And the goal was to decrease the time from symptom onset to diagnosis for all of these conditions that begin as bad periods, which is why we paused our work, because the companies were educating at the point at which a disease name was understood, but we know that it takes years to get to that point in time. So that's why we built Inspired Inside. And the learning objective is very simple. It's to understand what's normal and abnormal. And it doesn't focus in on any one particular condition, because the symptoms are present, they overlap. And we also don't want to overwhelm parents and students slash their children. So it's really just to identify what's normal and abnormal. And it's also designed to unlock a curiosity about how the interior of her body works, to balance a fixation on the exterior with a practical, actionable understanding of the interior. And we're doing that through art and science, as Representative Gilchrist pointed out. So that's just a little bit about Inspired Inside. I'm happy to add any more info that you need.
No, that's fantastic. Thank you for that context. And we will add that. So in the past, maybe I'll jump into this. In the past, we've had a conversation, and I'm going to stop sharing at this point. We've had a conversation about requiring some type of education. We've had two different conversations. One is requiring education K through 12 on endometriosis. I mean, I don't know if endometriosis would start the K through 5, but when age appropriate, there'd be the conversation. And just to give some context in Connecticut, kind of the barriers to that, having worked on back in the day, it was like 2008, I was in this coalition called Healthy Teens, where we were trying to get comprehensive sex education into the schools. Connecticut, when it comes to education curriculum, is really kind of like a local control state. And so the State Department of Education puts out guidance. And so we were able to get guidance out of the Connecticut State Department of Education on comprehensive sexual health education that schools can use. But at the end of the day, the schools themselves get to decide which which pieces and how to implement it. Similarly, there is a requirement in the state of Connecticut that there be sexual assault and awareness prevention education. I'm getting the phraseology wrong, but that's K through 12. And again, similarly, like there's guidance out of the State Department of Education, but when it comes to what curriculum and how schools implement that, that's up to each individual town in the state. And so we could go down the path of trying to require every school in Connecticut to teach endometriosis education. The immediate pushback is going to be, well, we don't do that with so many other things, and aren't they important too? And so I know Arlie, not to call her out again, Arlie has gone the path, and maybe others have, and please join in if you have, of going locally, because an advocacy tool we do have is that you can go to your local board of ed. You can meet with your local officials and say, I think it's important that we bring, again, like any of these programs or the programs that make the most sense into our school system, and make the case and make the pitch. That in the state of Connecticut, although incredibly frustrating that it has to be done town by town, seems like the best way to go, only because it's a lot of effort. And at the end of the day, having done this work since 2008 on different topics, it is very hard to pass a requirement for education policy in the state of Connecticut. Any thoughts on that? I hope that gives, yes, Arlie, go right ahead.
As always, I have lots of thoughts. Okay, so with digging into what is required in the state, because what I've learned is there is not a requirement for sex education, or what is required is disease prevention. And so the angle that I feel like would be good to take is that because there is a 7 to 10 year delay in diagnosis generally for this, right? We're gonna go in and be like, this is a systemic disease, and we are trying to create, shorten that delay. And because this is a disease. So I feel like we don't even have to talk about the fact that this is, it's not reproductive, right? We know this is systemic. It's a full body. I love Wendy. It's a full body disease. So if the state does require, the one thing they require is disease prevention, and we teach about HIV and AIDS still, right? Which is still a concern, but far less than, in my opinion, the endometriosis. We go in on that angle and say we are teaching disease prevention. So maybe that's a way to get it in the door. But the town's been pretty receptive, I have to say. The superintendent, the first select woman, and the Board of Ed are interested in learning more. So, but yeah, we'll see.
Very interesting. That's very helpful. Yes, Wendy and then Lisa.
I love Arlie's approach to this. It's great. I mean, the prevention thing. Of course, the drawback is not having people thinking, okay, we just put them on birth control because we're going to prevent periods from happening, which because it's retrograde menstruation stinks. We don't know that. So the drawback would be is it may not be a preventable at this time, but what we can prevent is the severity of the condition, right? Because we still don't know the origins of the disease. So we're not selling it down the pipeline of constantly going back to a theory that we have yet to prove. Because again, we're talking about prevention. So it's preventing it from progressing. There we go. So, or managing it, being able to manage it really early on when you just start to first get symptoms and take care of it. So, but I like that approach that you can spin it to say, well, this is a reason why you need to do this disease prevention, and put the prevention in asterisks or in italics. Oh.
I do too. I enjoy this angle. Lisa, followed by Carol.
Gonna take me a minute to get my hand down here. Sorry, folks. I'm a little slow on the draw here. Okay, great. So hi everybody. So I'm gonna go a little even further off base. I believe in the runaround effort. When you can't go straight through, you come through the back, right? So question to you though, Representative Gilchrist. Let's think about concussion education. Because like I'm thinking about what are the populations within the school that aren't necessarily, the sorry, disease prevention teachers or the health teachers, right? Who would care about the impact of something like this. So my first thought goes to maybe the athletic trainers or the coaches that are dealing with girls on different teams. And I know that there has been a lot of, then my mind went to concussion education because I know there's been a lot more emphasis on concussion education. I believe this came from the personal trainers lobby. They started this about 4 or 5 years ago. And I'm wondering if and where that is presented, and could that be an entry point for us to focus on talking to some of the groups involved in not obviously the concussion education, but giving the concussion education, or take a similar route through communicating with folks who are having those kind of conversations with student athletes, and see if there might be interest in expanding sort of that conversation to also include something like endometriosis, because from my own child's experience, it had a huge impact on their ability to be on swim team, was what their thing was. And I have a feeling that there's a lot of other people out there that might be a good way to get into conversations in the school system without having to go the traditional route. And then what we've talked about in the past is obviously the school nurses, trying to work with school nurses and go through the school nurses associations. Again, not directly, but could be indirectly something, because again, this is the folks who are going to see the students suffering the most on a regular basis. So they're going to know the population, and I think they might have a little bit more sensitivity to getting that information out to them than perhaps other populations in the school. So those were just a couple thoughts off the top of my head.
Very interesting. Okay. Thank you. See a lot of hands. So Carol followed by Kara. Oh, Carol, you're on mute. I was like, where'd she go? Because you're
I'm so sorry.
I was like, I don't think she's
like rarely mutable. Just agree that coming at this from the perspective of this is not sex or reproductive ed. And the stat that I use to sort of drive that point home is that in a survey, 78% of teen girls say that they learn more about the biology of a frog in school than they do their own bodies. And I say it like that, and then I look at the camera so that they kind of go like, oh, that's probably not good. And it's not good. It's bad for her self-esteem, self-worth, self-value. She can't advocate for herself in a doctor's appointment or even with her own parents. I agree with the athletic focus. That's been really successful for us, but because STEM cannot be left behind. So we have to, I don't want to say like the nerds, we have to focus on them too, just because they're not the ones out there winning the state championships on the field. And, that it seems like we always like sort of spotlight athletics. And I think specifically in this case, it's really important that we bring the STEM students in. And then lastly, to work, one of the things that we've been able to do, because we had a decade of having to do this prior, is to kind of jog around the friction or the roadblocks. And so doing Inspired Inside as an after-school program that's opt-in for both students and parents and guardians, that gives us the ability to get almost a full reproductive life cycle in the room. So we can go from, those who are just entering menstruation, as well as their parents and guardians. And then remember, they're all going to talk. So you're going to get a lot of impact that goes beyond the people that are in the room. So just wanted to share those points. Oh, I'm sorry. One other point on sports and on schools. At least in California specifically, I'm finding it. I've just recently moved to Nevada. I'm finding it here in Nevada too. They lose money every time someone's not in a seat. So one of the ways that you can go to them is go to them with the data on the prevalence and absenteeism and presenteeism. I'm happy to sit down and go through numbers in Connecticut, specifically with the largest employers, the school systems, to talk about the financial impact of absenteeism and presenteeism. I could say very roughly that it's in the multiple millions of dollars. They're bleeding out money because of this. So that's an angle. And then the last thing that I'll say is that data show that 1 in 2 girls drop out of sports because of their period. I'm one of them. Someone else mentioned that here too. Arlie's one of them. And we know that sports, even if they're not going to be an Olympic athlete, sports increases self-esteem, self-worth, leadership capabilities, the ability to pursue very complex curriculum like STEM. So just wanted to share those points. I hope that's helpful.
I'm taking notes. Thank you. Very helpful. Kara, followed by Lauren.
Yes. So I'm a registered dietitian, and I'm part of the Academy of Nutrition and Dietetics for the state of Connecticut. We are a national organization as well. And our organization just represents registered dietitians. But we are evidence-based providers. And so we use evidence-based nutrition every day to treat and prevent diseases, which we use food, we use nutrition, encouraging our patients to eat nutrient-dense foods. And so that being said, in our schools at the state of Connecticut, our curriculum always includes nutrition as a component. I know for my children, it started in kindergarten. They learned about back then it was the pyramid, yes. But we have a plate, and it's a graphic that's produced by the NIH, the FDA, Health and Human Services, and the CDC. So we do have robust nutrition, evidence-based nutrition information at the national level that we use on the state level. And so, fast forward, children are learning about nutrition in every grade, but in high school, they take health. And it probably is a phys ed teacher that's teaching health. And there's always a nutrition component in that. So I do love the idea that Arlie brought up that, yes, disease prevention is what we want for all Americans. That is the missing link in America right now. We don't prevent diseases in America. We do a great job of treating them, but we don't have time to think about preventing them. But my small little non-vocal group is on the forefront of always trying to treat and prevent with food. And so that being said, I love the idea of bringing endometriosis as a condition that, like, we simply don't know now that it can be prevented. But we know that all diseases can be ameliorated and perhaps slowed when we humans are ingesting very nutrient-dense food. And the plate is a very non-controversial graphic that really gives Americans and school children just what food is, basically, like what it is. And so every child in the state of Connecticut is getting some sort of education right now on that. And then I also wanted to bring up that I didn't know if Jasmina was going to talk about what EndoRise presents on the website, but I'm working with Jasmina to try to prepare an evidence-based nutrition guide for endometriosis. It's free. It is, so something that can be on the website, because using food to make ourselves better, especially, when we have a disease or disorder, it's very empowering and very comforting emotionally and physically to know that there is something that a patient can do every day to make themselves better. And so we're working through that. It's a rough cut right now, but that is something that hopefully is going to be available as a resource. So I just wanted to.
Thank you. Thank you.
You're
very
welcome. Yeah.
Lauren, followed by Arlie.
Yes, I just wanted to piggyback off a point that was made about the sport. I'm not sure if everybody is into the Olympics, but we actually do have an Olympic winner who has endometriosis. Her name is Brittany Brown. She actually is really excited to talk to young people about endometriosis and sports. It's not something that is often talked about. And in other states, there have been a lot of other, not other states, but other countries, there's been a lot of conversation about endometriosis in sports, but here it has not been. So if you all are interested in connecting with her, I know that's something that she would really love to do. She's 23. She just had her surgery probably about 2 years ago, but she has placed and she's getting ready to be in Tokyo. But her schedule's opening up for next year. So that's something I could definitely connect someone to her. I know that she just got a request to go speak to some high school students in Mississippi from a coach that she knows. And then also would love to hear more about not just high school, but what we're possibly working on and what we're trying to do for college students. As someone who was diagnosed when I was in college, I think it is really, really important to kind of provide them those tools, those resources at that age group as well, because they are literally becoming their adults and they're learning how to advocate for themselves. So I just wanted to bring that to the attention.
Those are all amazing, and I would love to connect with you. If we decide to do some kind of push for legislation, I mean, it would be amazing if we could get the speaker to come, the Olympic athlete to come in Endometriosis Awareness Month. That would be a nice rallying cry for the policy. Anyway, that's my advocacy hat on. Arlie, followed by Wendy.
Okay. Couple of things. Thank you for everybody's like input because my brain starts firing off. Years ago when I was growing up, there was something called junior achievement, and I believe that this was something that like the state had organized, and then I know it trickled down to the town, and then I remember my son's elementary school they didn't want to fund it anymore, but it was essentially like an enrichment program that was taught by parents. Like I was one of the parents that taught junior achievement, and you went in and you just taught them like basic information about like how a town operates and that the fire department, the police department get paid, like very, very basic. But I'm wondering, based on what was just said, if we could create something like that where we would come into the schools and teach. And again, this would be like an opt-in thing, so that it wasn't, people that didn't want their kids in sex ed or health class, they could take them out. This would be separate. Secondly, we now know with the most like recent information that's been coming out about menstrual health is that an athlete's performance is drastically affected by their menstrual cycle. In fact, you're at more of a risk for injury when you have your period. So I think that this is something that athletic coaches would be really interested in hearing about because as we know, like everyone, wants their athletes to be the strongest and the most fit. And you're really prone to injury when you are on your period and you're playing a sport. The other thing about food, I'm a health coach and nutritionist as well. And even though we know like nutrition isn't going to cure endo. And at the end of the day, as someone who eats a very clean diet but has had stage 4 endometriosis, it didn't matter what I put into my body. It doesn't treat the disease, but food can exacerbate, right? Inflammation. And we know that we can totally help control some of the symptoms of endometriosis through food. So I help a lot of college girls while they're in college, like trying to figure out how to cook for themselves and what to eat and what not to eat and food options in the cafeteria. Because I agree, Lauren, like that's when they're out there and they're trying to live their college lives and they want to be normal college girls and unfortunately they're dealing with this. So I know like Yale, for instance, I've worked with them over the years. Yale has something called Yale Bleeds, and it's an organization where they promote um, menstrual health. And there was a student there a few years ago. She graduated, but she did a tremendous amount about endometriosis through Yale Bleeds. So I think there's different organizations on different college campuses that are these feminist groups that are working to promote like menstrual equity and drop the stigma. But circling back to the food, if you need help in terms of what foods like do help support people with endometriosis, I'm happy to chat with you about that. And I have also reached out to a couple different coaches in town. And like I said before, they're super interested in learning how they can support their athletes because performance is a big thing. So just some thoughts. Thank you for listening.
No, thank you. And that's what was coming up for me when we were talking about the trainers was that newer research, which is so interesting. But I'm loving hearing from everyone because then my fear, right, is like, well, then it really kind of puts it into that like repro health category versus it being a bigger disease. But yeah, there's such a understanding and hook right now with that piece.
But the disease prevention part, yeah, I mean, like if you can get somebody when they're just starting to have symptoms and it's not delayed to the point where they're stage 4 and they're dropping out of their athletics or they're dropping out of any extracurriculars because they are missing it every month, for sure. That's a good angle. And I'm always super impressed by Olympians that have endometriosis. Like, I don't know how they do it. I think it's absolutely amazing.
Agreed. Wendy, go right ahead.
Oh, everybody's getting everybody's juices going today. It's great. I'll try to communicate my thoughts. It gets really difficult if it gets jumped up. Mentioning the after school programs that Carol Johnson was talking about, how you could look at making something similar to that. I've worked with one of the high schools before, and I see that there's a lot of student driven special interest groups going on through the public schools, at least. And what I think might be an option to consider is reaching out and getting a couple of these high schools that are, they have female studies, gender diversity studies, and maybe putting it to them an opportunity, a couple high schools of saying, here's a couple different programs and getting the feedback from them. Which programs would you like and why? So having them, because that might be something that they go, hey, we can look at 4 or 5 different programs and what really appeals to us. Now, I know that a lot of these programs have been developed, have kind of used the high schools to create their programs, but nobody's really taken the individual programs to them and let them choose that. So this is something to just think about as starting as a first step, like doing a little beta test on which programs would maybe of most interest across the state, and let those student-driven programs give us some kind of input. Then when it came to the nutrition part, obviously, we all know nutrition is really important, right? I mean, we all know what triggers our disease, and it may not be the same thing for everybody, right? But there are some certain common things. But one of the things that we always want to point out is obviously there's not enough research done on nutrition's impact on endo. And the second part is all the studies that we're seeing still are cross-sectional studies. So they're looking at people who have high symptoms and people who don't have symptoms and people who don't have endometriosis. So there's that look at people that are in the same snapshot of time per se, or within a study of a couple of years, but they're looking at these people versus longitudinal studies. of people who have endo and monitoring how their diet is. Now, there's obviously also the other variables of not everybody has painful endo, or not everybody's disease progresses. Those are variables you have to look at down the road, but pushing towards that. The other thing would be, obviously, yes, the disclaimer that, nutrition, no matter what you do, some people have severe disease. And again, we want the people to feel in control of what they're doing, have some control, but we also don't want to say to somebody that you're doing everything you can, but remember the disease, even though you're doing the best you can, the disease may just be that aggressive for you. And I think along the analogy is somebody with diabetes, who no matter what they do to control their sugars, they go blind, or they lose a kidney, or they have amputations, no matter what they're doing. So it's just important that we reiterate that to them, that it's glad you're doing the nutritional aspect, but sometimes the disease is just aggressive, but you're still doing something to help yourself. And then the last thing, obviously, is we all know how expensive it can be, eating nutritionally, eating clean diets. And so, that does come across. So I like the input that somebody said about the Yale bleeds, and just what the campuses are offering for food. So it goes down to literally the cafeterias being able to provide nutrition for them. So yeah, it becomes a bigger picture. The last point was, as Jillian mentioned, is the athletes, and how do we gear it towards them of, have really painful periods. We can also market it to, we do know, yes, ACL tears, the connective tissue changes with our hormones. So the risk of injury, the sensory feedback is changing with you're an athlete. But we also have people that they're nauseated, or they're vomiting, or they may have, a leg pain that doesn't capture that reproductive symptoms, severe migraines during their cycles. Endo is higher for that, or higher for the diarrhea and the constipation. I can't control that. So being an athlete and I'm on the playing field, wait, I gotta go. How well does that come across? So that's how I would market the full body disease aspect of it, and not just, oh, she's on her period, and she's bent over and she's like, got the uterine pains or some back pain. And that would just help give the bigger perspective of how it appears otherwise. So I think I got everything, and I hope I explained that okay.
Yes, you did. It was fantastic. Thank you. And I was rapidly taking notes. Lauren, followed by Holly.
Yes, this is my last point. I wanted to say two things. One is that we could even go as far as doing something simple, which is just providing health literature, and having those resources. Something that Indo Black does is we do a period initiative where we pack period care kits, and we take them to high schools, and we have non-toxic period care items, lip gloss, stickers, and then we have a menstrual health literature that talks about here are the steps to managing your pain in a healthy way. And if you are suffering from pain, here are some tips to tell your parents. And if you are severely suffering from pain, please look into adenomyosis, endometriosis, PCOS, and fibroids. So that's something that we utilize and we try to do. And we also incorporate the students when we update that literature. We also share that with our board and some of the people that really like our partners. We also do go to colleges as well. We try to have a mini talk series with colleges. We partner with Howard University, which is like Howard University Society of OBGYN. So really just partnering with those medical students who are already in the space that are trying to do that work, who want to really make a difference. And then really just whatever they want to talk about, we kind of just provide the resources, and we provide the speakers or the guest speakers based off of the topic that they want to discuss, but it's always surrounding reproductive health or endometriosis. It may be like advocacy, it may look like research, or it may even look like health disparities, but we try to find people that are specific to those topics that they want to talk about. And then the last one is for college students. I think we could even go as far as creating not just a tool guide or a toolkit for them about healthy eating or nutrition, but how do you have a nutritional diet on a college budget, right? Because someone already said that it is not, it's not cheap to eat healthy, but when you're in college, it's completely, completely different, so it's easier to just get oodles and noodles. The time that they have that they try to manage, it is a little bit difficult. So how do we make these healthy meals? And I have another job because I don't know why I have so many jobs, but I am a partner manager for a company called Hungry Harvest, where we actually package fresh produce, fruits, and we ship them out to certain locations. But we work with a lot of institutions such as like Mercy Hospital. We work with Absolute Care, and they focus on actually educating people on how to use the items that we send them to have like a healthy meal. And it's easier for them once they're learning how to do it, where there's a course and they're actually being taught how to do it. So I just think it would be easy for college students to have like a step-by-step guide of you can shop at this location, you can get these items for a reasonable price, and you can make this, and this is healthy for you.
Fantastic. Thank you. Thank you very much. I need to jump off, so I'm turning over to Arlie, who's going to continue chairing. And Holly, go right ahead.
So one of my questions, I'm out in California, one of my questions for Connecticut and for our state as well that I will have to look into the answer for. But the question that popped up to me is, what are the university and state campus and community college campus, like the whole systems of those campuses? Do they require anything in their health offices to be, they have their nurses there for students at the college level that are coming in with pain or symptoms of different kinds. And so that's a question that I have for myself that we're going to have to look into as we've worked with, a graduate student in occupational therapy and some other college campuses that we've been at. There doesn't seem yet to be a cohesive college system program where at least in every health office at each college campus, they're getting the same information across the board. So that was one question that kind of piqued my interest. And then the other thing I wanted to mention is that I know in California, at least, according for the ADA, the money that the schools get for the person being in the seats, there is a way that you can get, and I guess this gets back to your PCP for young people or mainly young because we're talking about elementary and high school ages for that ADA. But if you do get a letter from your practitioner saying every month, my student, as a parent, my student has these concerns, can my student get independent study a couple days a month? And by allowing the student that through the elementary and high school programs, then on those days when they can write down the dates, then the school can still get the ADA. And so one thing that piqued my interest there is, well, maybe we need to be providing a letter template for parents to be able to take to their PCPs on behalf of their child so that they can get it filled out. It's already like a template for them to do. And then the PCP, hopefully they know enough about endometriosis. It's a whole nother topic, right? But at least, if the PCP is somehow on board, then that starts to bridge the gap and bring awareness to those elementary and high school campuses as it specifically relates to the economic burden that it places on the schools by losing those students' attendance each month.
That is actually a really good point. And we, I think it was our last meeting, but if you weren't here, that's okay. Endo Excision for All is a nonprofit organization that is currently, I'm working with them. We're currently writing with a lobbyist to try to get endometriosis under the ADA. We're also looking at potentially having it fall under like a 504. And what that basically means is that the student would not, be penalized for days missing from school, that would be sort of like a protection for the student, and that the pediatrician would be aware of that, just like a normal 504. So that's something that's being put into the work, and that's not actually at a state level. They're actually pushing for that at a federal level. So hopefully that will come through, and then that will protect students, because like I personally almost didn't graduate high school because I had so many absences. So it is a real concern, and for students to have to explain themselves to their teachers and whatnot, it can be very embarrassing. um I know, Carol, you have your hand up. Go ahead.
I'm so sorry. In California last year, they passed legislation to mandate education that goes beyond sex and reproductive ed. So they're calling it menstrual education. I'm a bit nervous about it for a couple reasons, because without the guidance of the people who are on this call, those types of programs often get off track. It takes a long time for us to sort of put together all the pieces of this puzzle, whether it's endo or adno or PMDD or what have you, right? Like it takes time to figure out how this works and how the audiences that we want to impact receive this information and process it. So they did pass it, and it's statewide, and the budget is $200,000. And each school is independently responsible for implementing it. So right there, just going to say from a production standpoint, it's a disaster before it's even like gotten, it's a great idea. It's so needed, but it actually, the amount of money would probably work. It's the way it's being deployed school by school by school. But in working with schools in California, what they've repeatedly told me in both Northern and Southern California is that when a program is implemented at a particular school or district, measuring that program and then taking that data and sharing it is how the program gets adopted. And it works really quickly because they've had to do this method of sort of playing telephone with each other as self-preservation while they manage their strict budgets. So that's how they do it. I think just kind of identifying, a district that wants to work with you and then making sure that you can measure the impact of the program, and then being ready to take that story and spread it very quickly is a way to get some traction there. And then that menstrual bill, that proves that, they're open to and recognize the need for this. And again, I reinforce that you have to come at it from students in the seats and the money that they lose as a result of not having those students in the seats. And the academic performance too, the hit to the academic performance. So those metrics bring them money. And so if they're getting throttled as a result of disease, then they will take action. But you just have to, once they say they'll take action, you have to get in there and kind of clean up what they think is the right way to go about taking the action.
Absolutely. Yeah, and we've learned a little bit, like I've learned from digging into sort of what is required nationally and then what is required per state. It's all different. It even trickles down to district and then town and then superintendent. And then quite honestly, it trickles down to who's teaching that class and if they are comfortable teaching things. They all have different options in terms of diagrams and what they show and what they teach. And again, it goes back to like there is no national standard for sex education or health education. It's not required, and it's what is sadly what the teacher is comfortable with. So Planned Parenthood actually right now has something circulating. It's a free course for health teachers or any teacher. It could be a coach, it could be a mentor, sex education, so that people are more comfortable. Because I think also we have to remember that, you know, these teachers, they didn't go to medical school. Like they aren't given all the information, so they might not feel super comfortable as well. But great points. Absolutely.
Arlie, you got muted.
Sorry, meant to check the chat and I muted myself. Thank you. I saw somebody put in the chat and I couldn't agree more that we do need to also tackle the mental health that can be drastically affected by you know, suffering from any of these conditions. And that's something that we should also follow up on. Um, I know Endo Rise has an update, so I just want to make sure we're leaving enough time for them to give us an update on all the events that they have coming up, and anything else they want to fill us in on. So whoever's on that wants to take over for Endo Rise, go for it.
Yes, I will share my screen with everyone. Does everyone see my screen? Okay. So just going to give an update of what we've been up to since last meeting and what we have coming up. This past Saturday, our team with clinicians and us from the Endorise program attended the women's volleyball and soccer games at UConn stores. So it was a great night. We had a lot of we gave out a lot of pamphlets and a lot of materials that we distributed, raised a lot of awareness. We believe we had a Farmington High School volleyball team also attending the volleyball game, so that was a big hit and a great target audience to kind of reach a younger population. We also did a podcast, Sober Spill podcast. It was at the Mountainside Treatment Center in Canaan. They see a lot of patients that come through that have endometriosis, and kind of goes hand in hand with the pain management of people that are in recovery, and being a resource to them for their families. So we are partnering with them. So we're going to be distributing our pamphlets and brochures, so that way they can hand them out to their to the people that come through. Currently in the works, we are going to be attending the Connecticut School-Based Health Center Conference in November. So we're going to have a table event, so being a resource for all the health care for schools, so nurses, providers that are part of the Connecticut School-Based Health Centers. We're in the works of also doing a Newington presentation to the Newington High School here in Connecticut. So this is going to be through their STEM program, but it's a great opportunity for us to share the intersection between research, clinic, and patient advocacy, and raising awareness. And that kind of goes in what we talked about, trying to do school by school or town by town to just raise more awareness. We're currently in the process of expanding to Trinity Health Center, so hopefully for collection for the biorepository. So enrolling that demographic of patients that come through. Hopefully by the next meeting that will be kicked off. So we're really excited to offer the Endorise study to those patients. We're also in discussions with Hartford Healthcare, so trying to also expand to Hartford Hospital, and this would be really good for the research and also for patients, because this would be targeting the pediatric patients that see gynecologic specialists there. So that would be adding additional participants to our website and really trying to focus how the disease occurs from the research at such a young age. And then by repository updates, we're currently working on our yearly legislative report. So updating the legislators all of our aims that we were tasked to do. So that's due at the end of the year, and we're currently in the process of putting that together. And for the biorep, we have a new research assistant that's helping me process all the biospecimens that we're getting. And we are seeing a great uptick in enrollment from participants that want to be part of the study. So collecting their biospecimens, but also the longitudinal work surveys of quality of life impact pre and post surgery. And just another reminder, we have our EndoRise Fall Forum event coming up. It's a hybrid event. It's free. It's a half-day event at the Jackson Laboratory, and it's open to the public. We've had members from the work group, a couple members from the work group email and ask if it's appropriate for patients. And yes, it definitely is. I think it will be great discussions and a lot of great resources for patients and to kind of just see what's coming up for what the advances that we're making in the research, but also from the clinic and seeking patient advice on what we could do to improve our resources. And we are looking for sponsors for the event. So if you guys know or anyone or would want to be a sponsor, please let us know. And I'm happy to share the flyer with you all. The registration is on our EndoRise website. And I also did email the materials and invites to everyone on the work group. And with that, that is all. Any questions? Thank you all so much. Look forward to seeing you at the event.
That's great. Thank you.
Yeah.
Does anyone have anything else that they would like to bring up in terms of things that they're personally working on or that they would like to share? Just more insight into what we discussed today. I feel like we kind of talked about a lot of different things. So if anybody has any like final comments, Lauren, I see your hands up. Go ahead.
Yes, I love this conversation today. I haven't been able to be a part of these calls in a while because I have my full-time job, but was really glad to be here today and just hear all of the great conversation going on. I wanted to take a moment to share that next year for Endometriosis Awareness Month, at the beginning of the month, we will be working on a program called Healing Through Art. This will be an opportunity for individuals to come out and basically walk through an art gallery of photos of women who are impacted by endometriosis, specifically Black women with different variations of stories. You have a Black woman with her mother, her grandmother, they all have endometriosis. They all have support systems, and we know that that's not a common thing. Intergenerational support with endometriosis can be very tricky. We also have a woman who is a veteran who is going through infertility challenges right now. So we have different images of different people, and we are opening it up so that people can come and do a walkthrough. We're also going to do a panel discussion that same day and have some of those people on the panel. And we're going to talk about self-care, mental health, wellness, and endometriosis, and how all of those align and how all of those work. They should work closely together, but we know that they're very much impacted by all of the experiences that people have. So that's something that we are doing, and I hope to share more information as we get closer to the date.
That's awesome. Thank you. And do you want to just, because I know you're not in Connecticut, you're in Maryland?
Yes, I'm in Maryland.
Okay. Okay. So will any of that artwork or any of that presentation, will any of that be like virtual? I mean, I'm sure you guys will be posting things online, but are there other ways that people can see that? It sounds great.
Absolutely. So our intention is to develop some health literature in partnership with two mental health therapists. So that is going to be digital. We'll be able to share that. We'll also be recording the actual panel discussion so that that will be something that is an ongoing a video on YouTube where anybody can access it at any given moment.
Awesome. Awesome. Thanks for sharing. That's great.
Absolutely. Thank you.
Yeah. Wendy, go ahead.
Hi, Arlie. So clear over here on the West Coast, which is always seems to feel like it's so far removed from everything that goes on in endometriosis with the with obviously with what's going on in Connecticut, but also just then everything happens in Washington, D.C., right? If you need stuff done. So I just want to give a shout out to Holly, who's here in the video as well, and one of our other volunteers, Nikki, for we just got a little grant. Next year, we decided not to do it in March, but we'll do it in April. It's in a rural community. Their hospital, it gave us a grant, and they're going to host a Zumbathon. It's going to be an A to Z because we know obviously I have an A to Z book about endometriosis, right? So it's the A to Z's of endometriosis, and it's going to be open to obviously the public. And so people that are coming, hopefully we'll have a display up, we'll have some more interactive things for them. And then we are doing a big event at Washington State University. I'm going to get in the car today and I'm driving 5.5 hours because our states are very large out here out west. And so we are working with the Panhellenic societies. And so we will be doing an interactive program on Wednesday, but we have a few other gigs going on around it for endometriosis awareness to try to really focus on that community aged group. So that is our excitement so far. We just take it as it comes and we're just rolling with it. And yeah, so it'll be exciting.
That's awesome. Love to hear what you're up to out there. It definitely impacts. I will say I follow everything you do, and it definitely impacts my thoughts and what we are doing out here. Just a personal note. I have reached out to both of the universities here in the town I live in, which is Fairfield U and Sacred Heart, because they both have nursing schools. I need Jillian's help because I don't think that they're really understanding who I am or where I'm coming from. But my goal for March is to screen Below the Belt again at the theater that they own here in town. And I know March is a little farther away, but I think a lot of us are already, wheels are turning and plans are already starting to be made in terms of what we will be doing in March. And I know EndoRise, I'm sure you have a full agenda for the month as well. So those are just things I wanted to share that I'm doing down in the area that I live in. And so I think we have like 5 more minutes. If anyone else has anything personally that they would like to share, please feel free to do so at this time. And then we'll wrap it up. But I think this was like a really great meeting, and it always gets me really excited and pumped. So thank you everyone for bringing that energy and positivity to this meeting today. So feel free to go ahead and unmute yourselves and share, because I don't know if I can see everyone's hands if they're up or not. Go ahead, Wendy.
Did we record this session? Because it's such a good session and I was trying to tap as fast as I could, but my fingers don't move that quickly. And it's 2 steps forward, backspace.
Yeah, no, it is currently being recorded. Yep. So
okay, so can we get a copy of that? Because I mean, we all shared so much and it's just a good amount of content. How can we access that? Because I usually don't get it.
I think it gets uploaded to YouTube on the CT network.
Okay.
Yeah, just
thank
to
you.
jump in, it's available on the Human Services YouTube channel.
Okay, Connecticut.
Can
somebody send me a link to that on the YouTube so that I don't, go down a rabbit hole and then I end up, oh, look at all these other things that there is to look at on the internet. YouTube.
Yeah, I'll pop that in a second. One moment. Oh, there it
Thank
is.
you.
awesome. Okay. Yeah, I guess, I mean, we finished a few minutes early, which is nice, I guess. I don't want to like cut anybody off. I just want to leave space for anybody that wants to add any final thoughts or ideas for awareness in the month of March. All right. Well, I guess then we can be adjourned. Thank you guys all for coming and for everyone's contribution today, and look forward to our next meeting. Hopefully we'll have some more information about how we can continue to push this forward. But thank you again for everybody's input and everything that you all do.
Yeah, thank you.